All right, let's take a deep breath and jump into the respiratory system. So basically, in this video and probably the next one, I'll probably have to cover this topic over the span of two videos. We'll talk about the structures and basic functions of the respiratory system. And we'll talk about the difference between ventilation and respiration because it is important to understand the difference between those two. So basically, what we'll cover over these next couple of videos are in this one, we'll cover the basic functions of the respiratory system. We'll discuss how the basic design of the system allows this to basically effectively do its job. And then we'll talk about the two major divisions, the upper and respiratory divisions of the respiratory system, and then the physiologic or the microscopic functional anatomy of the system itself. So in this video, probably it'll for sure be the first two bullet points, possibly probably the third one, or most of the third one as well. And then the next video will probably have to break it down into these ones here. So, all right. So let's talk about the respiratory system. So basically, the respiratory system has a few different functions, serves a few different purposes. But basically, if there was one major function, it would be this first one here. That is to bring in processed air for gas exchange. So basically, what we're saying here is we're saying that the respiratory system is responsible for two things: ventilation and respiration. Okay, ventilation and respiration. Do not confuse the two or use them like they're the exact same thing. They're not. Ventilation, simply put, is just the movement of air. So when we're talking about the respiratory system, we're talking, and we'll talk about these in later videos, you'll learn about the mechanical process of actually moving air into the respiratory system and then blowing air out. And there are certain mechanical processes that are involved in that. But that's what ventilation is. And then respiration is the actual gas exchange process that occurs. And remember, I mean, you have to think of this process in terms of gas exchange, because we're not just talking about collecting oxygen, we're also talking about simultaneously getting rid of carbon dioxide. I know our whole lives we're always conditioned to talk about the importance of oxygen and how vital it is to our life, but but regulating carbon dioxide levels in the body are equally as important. So we have to make sure that we focus on this as basically as a simultaneous process: oxygen in, CO2 out. But obviously, we cannot have respiration without ventilation. We have to move air in order to allow gas exchange to occur between the atmospheric air that we breathe in and our blood. And we also have to blow air out so we can get rid of carbon dioxide and then replenish our lungs with more air with oxygen and so on. All right, so that's the main function of this. Now, that when I say processed air, we basically have to prepare that air for gas exchange, and that occurs during the process of ventilation. There are three major parts of processing air: filtering, humidifying, and warming the air. All right. Now you have to remember that the respiratory system is directly exposed to the outside world. We are breathing air in from outside of our bodies, so that means that's direct exposure. All right. So basically, we're breathing in, fungal spores, viruses, pathogens, debris, smog. Hopefully, not all of the above. If you are, relocate. But basically. But you get the picture. We are breathing in a bunch of stuff that's in the air that we don't necessarily want inside of our bodies. So we have to filter that air and then make sure that it's clean to protect our lungs. The humidification process just makes gas exchange a lot more effective, which I'll cover later on. Same thing with warming air, because remember, we're talking about the movement of gases. And remember, gases are basically, atoms or molecules that are constantly moving around. The more we warm the air, the more movement and more diffusion that's going to occur, because gas exchange in the lungs is a passive process, meaning that it's basically passive diffusion. So the warmer the air, the more effective the gas exchange process will occur. All right. So that's the primary purpose of the respiratory system: bringing, basically ventilating air for the process of gas exchange. All right, collecting oxygen, simultaneously getting rid of CO2. All right. And another function of the respiratory system is monitoring pH, or I shouldn't say monitoring, regulating pH. The nervous system is monitoring pH, and then we use the respiratory system to carry out to balance it out. Now, I'll say this right now, and we're going to come back to this concept later on, and when we get more into the physiology of this. But basically, I want you to start thinking of carbon dioxide as an acid. Okay. Now I know carbon dioxide itself is not an acid; it's a gas. All right. However, when we transport it in the body, we primarily not completely, but we primarily transport it in the form of an acid. All right, in what's called H2CO3, carbonic acid. All right. So basically, as we accumulate CO2 in the body, that's essentially like in a sense, that's like accumulating acid in the system. All right. So basically, if for whatever reason we're accumulating more carbon dioxide and our pH is becoming more acidic, or we're, it's going down on the pH scale, um, basically you can already figure out what's going to happen to our breath rate. We're going to increase our breath rate. All right, we're going to blow out more air so we can try to blow out more CO2 and balance our pH. Or if you're accumulating other organic acids in your system, like other metabolic waste products, one of the ways to try to help balance out our pH is to try to just get rid of excess CO2 again, to try to help slightly balance things out. So like I said, even though even though carbon dioxide isn't an acid, we primarily transport it as an acid. So I want you to think of CO2 as behaving like an acid in our system. All right, and that basically and that we monitor, and by monitoring carbon dioxide, it's a critical component to maintaining pH. All right, and like I said, we'll get into that in a lot more detail later on. Excuse me. All right. Or vice versa, if our pH becomes too basic as well, we can lower our breath rate to try to retain CO2, to try to bring our pH down to make it more acidic. All right. Or acidic. All right. So that's the role that it plays in pH. Like I said, this is something we'll revisit more in depth later on. Another key aspect of the respiratory system is what I like to call defense by design. All right. Now, if we kind of come back to the main job of the respiratory system, bringing in air, atmospheric air. Remember that is air that's outside of our body that the inside of our body is directly exposed to. So, like I said, we're breathing in a lot of unwanted materials that we don't want in our. Even if you live in an area where there's no pollution, there's still unwanted materials in the air that we just don't want. All right, and unwanted that we don't want. That was well thought out, but you get the picture. So basically, the main airways of our respiratory system, called the conducting airways, which I'll elaborate on more in a bit, are heavily lined with mucus, or mucous membranes, ciliated epithelial cells. And basically, those mucous membranes are, remember, mucus is a really sticky substance. So as air physically comes in contact with with the mucus in there, all right, those unwanted particles get trapped in the mucus, and then we propel the mucus up and out, and I'll cover that more in a little bit. All right, and then there's also antibodies, IgA, enzymes in the mucus to help us ward off any potential pathogens that we breathe in as well. So another secondary function of the respiratory system is vocalization. Basically that's what our larynx, i.e. our voice box, is for, and we'll cover that in a little bit. But basically there are vocal cords that we can change the position of and the tension of to create these audible buzzing sounds, and then we manipulate those into an audible form of language. So as air, but obviously we need air to pass by those vocal cords, and that's why the larynx is essentially connected or part of the respiratory system. All right, and we'll cover that more in a little bit. Now the nose does play a role in smell. Now, obviously, the perception of smell is a function of the brain and the nervous system, but basically we can't have smell without the nose. All right, because we breathe air in. Remember that we've got, on the superior aspect of our ethmoid bone, we've got the olfactory bulbs. All right, and then projecting down are the first cranial nerves. Cranial nerve number 1, collectively. Olfactory nerves, and then those nerves are embedded within the mucosal membranes of the nose. And then as we breathe air in, odor molecules get trapped in the mucus, and some of those molecules in the air can set off those, can start generating action potentials from those olfactory nerves up to the bulb. Then the olfactory bulb processes that input and then generates impulses to the brain about that. All right, so that's something to keep in mind. So we use the nose to trap odor molecules, and then the nerves that they come in contact with those odor molecules that detect those start generating impulses to the brain from the olfactory mucosa. So that's essentially where smell begins. So the reception or detection or sensation of smell. Reception of smell occurs in the nose, and then the perception of it occurs in the brain, obviously, when we process that information. All right, but again, the first and foremost, the primary function of the system is to bring in air for gas exchange. All right, now basically, there's some critical key aspects that allow the respiratory system to do what it does. All right, for starters, when it comes to filtering that air as we're breathing it in, the nose, which we'll see in a little bit as we go into more detail, the nose has very, very tight quarters. All right, so basically the nose actually has a pretty big surface area, but that surface area is kind of compacted, very tightly between bones called conchal bones, which we'll take a look at in a bit. All right, so basically the tight quarters within the nose allows that air to come in contact with mucous membranes, and that allows us to filter, humidify, and warm that air quite well. All right, because basically those tight quarters allow us to trap water molecules, and then mucus is wet already anyway, so that allows for humidification to occur, and so on. All right, and then remember that the respiratory system is kind of similar to the cardiovascular system in the fact that we operate in this system over a large surface area. So remember when we talked about dispersing blood throughout the body, when the left ventricle pumps blood into the systemic circuit, and then arteries start to project away from the heart. All right, arteries start to project away from the heart. Remember that we start out with the very large aorta, and then there are branches from the aorta, then branches from those branches. And remember that as we get further away from the heart, blood vessels get smaller in size, eventually to the point to where they're microscopic in size. All right, and remember that allows us to maximize our ability to transport and deliver nutrients and gases, and also pick up waste products from our tissues on a more individualized basis, meaning that when you have microscopic capillaries passing through tissues, passing through cells and tissues, all right, that means we're coming in more direct contact with more individual cells over a larger surface area. Same thing with the respiratory system. As we breathe air in, all right, we breathe in air through large structures, and those structures eventually branch out to where they're microscopic in size, except they do all this within the lungs. And then basically the air sacs in our lungs, called alveoli, are heavily coated with pulmonary capillaries. So we disperse air over a great surface area, and again maximize our ability to undergo gas exchange. All right, so that's something to keep in mind. And so we not only work over a large surface area, and if you want to deal with trivia about this, I mean, people like to say that if you were to take the lung tissue, if you were to take out the lung, spread out all the tissue in the lungs, it's about the size of a racquetball court. If you actually spread out all the tissues in the lungs, that's how big that surface area actually is. So, but again, big whoop. But that's if you want some trivia, there you go. But still, that does tell you though that how big the lungs really are when you actually spread it, when you actually look at the overall surface area within them. Now the other key thing here, so not only are we talking about a great surface area, but also close contact. Now remember the main function of this gas exchange, moving air in for gas exchange. We move air into these microscopic air sacs called alveoli, all right? So we breathe air in through the airway, the conducting airways, I'll talk about that in a minute. And then air will eventually reach these little microscopic air sacs, and then basically, like I said, kind of covering these clusters of microscopic air sacs are pulmonary capillaries. Now, histologically, they're both essentially, they're not the same. They're the same, and they're generally the same, but obviously there's a different cellular makeup here. But basically, alveolar air sacs are, I'm just going to abbreviate this, simple squamous epithelial tissue. I hate epithelial tissues. All right, long names. Now, remember, capillaries are made out of that as well. Remember, capillaries are just made out of endothelial cells. All right. Alveolar air sacs are made up of a handful of different cells, but histologically it's still just one thin layer of cells. So basically, air, as we're undergoing gas exchange, that's occurring over a very thin membrane. All right, that's occurring over a very thin membrane, and the two sites where exchange is occurring are really close together. Remember capillaries and alveolar air sacs are both made out of epithelial tissue, so they both have basement membranes. That's essentially the only thing that really separates the two. Are their kind of sticky basement membranes. All right, so they're really, the picture doesn't really do this justice, but you get the picture. All right, the pulmonary capillaries and alveolar air sacs are really close together. So the combination of a giant surface area and close contact of where respiration, where the physiologic aspects of the respiratory system occurs, creates quite the efficient system of gas exchange. All right, so we'll cover that more later on. And like I said, I've already covered this, but again, it's important again that you know the difference between these two. Remember, ventilation, simply put, is just the movement of air, whereas respiration is the gas exchange process, the physiologic, the cellular physiologic function. Okay, and remember, when we're talking about gas exchange, we're talking about the exchange of oxygen and carbon dioxide between inhaled atmospheric air and then blood that is flowing through the pulmonary capillaries. Okay? Now this picture right here, kind of, it's just really cool. I actually just found it at the last second when I was putting this together, and so I just wanted to throw it in there to give Brian Brandenburg props for making this picture. But basically, this kind of shows you right here. So, I mean, we breathe in, with every breath we take, we breathe in about 500 milliliters of air. Now, it's going to vary depending on your body size. A smaller person will take in a little less. A bigger person will take in a little more. But we bring in about half a liter of air per breath. Now, that's obviously nowhere near the full volume of our lung capacity, but that's essentially all we need to take in to sustain life when we're at rest. So we breathe half a liter of air in through our nose, all right, and that half a liter of air is squeezed through very small, tight areas in the nose, and it's heavily filtered by mucous membranes, where it then turns down the pharynx and then travels down the larynx and then the trachea, i.e. your windpipe, and then moves into these bronchi here. All right, and then notice here where you see these bronchi as they branch out and get smaller. All right, and as we move towards the peripheral or the superficial areas of the lungs, that's where all these little microscopic air sacs called alveoli are located, and that essentially is where the physiologic aspect of respiration occurs, gas exchange. All right, so you can see that we take that half a liter of air, we disperse it over a very large surface area, and that allows us to maximize the amount of O2 that we take in and CO2 that we remove from our blood. All right, which is a really neat system. We're going to revisit all of this in a lot more depth as we talk about these structures individually. But I just wanted to use this picture to kind of reiterate that point. And like I said, just give Brian here props for doing this awesome picture. Now, before I move on, I want to say something right now, and because this is something I'm going to revisit. Notice the liver here on the right side of the abdomen. The liver is a massive organ, all right? It's a big organ. Now, notice how the liver, most of the liver sits underneath the right lung. So basically, you've got the diaphragm in between the liver and the right way. The diaphragm is on the underside of the whole thoracic cage. But notice on the right side here, the liver presses up against the right lung. Now, remember that because there are going to be structural differences between the right and left lung. The right and left lung are not designed the same, and one of the big aspects of those differences is the presence of the liver essentially taking up so much space on this right side. All right, now I'll talk about those structural differences in the next video. Okay, so let's talk a little bit about the mucous membranes that are found within the airways, because remember I said that I said that we have to essentially process that air that we breathe in. And throughout the vast majority of the respiratory system, there is going to be this ciliated epithelial tissue that basically coats the airways. Now, there are basically two key aspects to the respiratory system. There are what we call the conducting airways. conducting airways. You've actually heard me say this before already. And then there's what we call the respiratory zones, or respiratory area zones, just kind of the word you commonly see for this. So when you see that word conducting, think movement. So we're conducting, we're moving air in. All right, we're moving air in. So we're moving air in through the nose, down the pharynx, down the trachea, throughout the bronchial tree, dispersing it throughout that big surface area, throughout the lungs, and eventually getting it into those microscopic air sacs that are coated with capillaries for gas exchange. Now, remember, I keep coming back to this, but it's really important that you really grasp this concept of filtration, that the inside of the respiratory system, the inside of the body, is directly exposed to the outside world. So the conducting airways are, not all, but the vast majority of them are coated with this mucous membrane. All right, they're coated with this mucous membrane, so or the ciliated epithelium. Now, basically, the ciliated epithelium is going to vary depending on where you're at in the conducting airways. Some areas are going to contain goblet cells, some aren't. Remember, goblet cells produce and secrete mucus. Once we get further into the lungs, into the bronchi, we don't really see this pseudostratified columnar epithelium anymore. Excuse me. But what we see is we see more cuboidal cells that are ciliated. All right, that propel mucus around. But the main theme here, whether they're pseudostratified columnar cells or whether they're cuboidal cells, they're ciliated, and on the apical surface or upper surface of those cilia you're going to find mucus. All right, you're going to find a coating of mucus. And remember that mucus is wet. All right, and it's wet and it's sticky. Okay, it's sticky. So as we breathe air in, and air comes in direct contact with this sticky membrane, all right, as it's passing through the conducting airways, we trap those unwanted particles in the air. And that's where the majority of filtration occurs, all right? So because like a lot of people like to think, because you have hair in the nose, the hair filters things. It really doesn't. I mean, some people look like they're trying to grow a forest in their nose. I mean, even if you have a lot of hair in your nose, it still doesn't really act as a good particle filter. I mean, that would prevent, bugs from getting in, but that's just gross to think about anyway. But when we're talking about particle filtration, like fungal spores or dust, junk and smog, smoke, pathogens, all right, we need this sticky mucus, all right? We need the sticky mucus, and we need air to come in contact with that sticky mucus. Now, remember, so that's one key aspect. Now, remember, mucus is basically just a protein called mucin mixed with water, okay? It's a protein mucin mixed with water. And when you mix the two together, you get that really sticky substance, mucus. Now, it's good that we trap materials in this mucus. However, it doesn't do us any good just to let it sit there, or else we'll just build up junk in there, and it'll still build up in our system. So that's why that's the purpose that cilia plays. Remember, cilia, like when I think of cilia moving, I think of, the few times I've driven through the state of Iowa, where you see these massive wheat fields on a windy day, where you see the wheat kind of blowing around in the air, where it's kind of bowing back and forth. That's essentially how cilia kind of moves around. It kind of whips back and forth, and as it does that, it propels. In the respiratory system, we're essentially propelling mucus up and out. Right, because like I said, we not only want to trap that mucus, but we want to, get it out. Then that's when you cough up a lung nugget and hack it out, and just make sure you do it in the grass. Don't do it on like blacktop, or that's just gross when you see a big wad of snot on the sidewalk. But that's essentially what that's all about. Now let's kind of rewind here for a second. Let's think about smoking. Now, when I say smoking, I'm talking about first-hand smoke. I'm not talking about second-hand smoke. All right. So if you smoke and you directly inhale that smoke into your conducting airways, what that smoke is going to do, the chemicals and the junk in that smoke, essentially, what it's going to start to do is it's going to start to paralyze the cilia. It's going to basically inactivate the cilia. Now, let's picture this here for a second. So that cilia becomes inactivated, and now all of a sudden what you have is you still have this wet mucus grabbing junk, but you're not moving it anywhere. You're not moving it anywhere. So as you smoke throughout the day, that basically you're just building up this mucus and you're building up all this junk that is being trapped inside of it. And then you go to bed at night, and then you wake up in the morning, and then all of a sudden you start coughing and hacking, and that's what we call smoker's cough. And it has a really, and smoker's cough has a fairly distinct sound to it because remember, you're trapping this kind of wet, sticky substance in your lungs. It kind of has this long, kind of hacking, wet sound to it, and then obviously, well, what do you do to stop the cough? You light up a smoke and basically kind of relax those cilia again, because when you sleep for a while, when you sleep for a few hours and you're not bringing in that smoke, those cilia essentially kind of wake back up, and now you're trying to propel that excess mucus buildup and all that junk trapped in there up and out. Obviously, the real solution would be to quit smoking, but that's a lot easier said than done. But which it is. But that essentially is what happens there with that. And in an application of this, I used to for example, I saw a patient once who was confined to a wheelchair due to a spastic condition, cerebral palsy. And was also well, I'll just stick with that. And this patient eventually got pneumonia because this patient still smoked and could barely move. Now picture that. I mean, think about this. If you ever gone out for a run or exercise or physically exerted yourself, this is like the only thing that I don't like about running is that that first half mile when you're running, that's when you start hacking up all the junk out of your lungs and all that stuff starts coming out, because as you're mechanically as you're increasing the mechanical forces of breathing, you're forcefully moving air more forcefully. That was well thought out. As you're moving the air more forcefully throughout the conducting airways, you're going to bring up a lot more of this debris. All right, so moving around helps you clear out your airways even more. Now this patient was essentially, like I said, confined to a wheelchair, could barely move, but still smoked. And when this person would actually smoke, I mean, this individual's sputum, i.e., the mucus, was literally as black as the tar you see on the road. All right, it was literally jet black. And because that was, well, let's talk about that for a sec too. What is that? Because in middle school and elementary school, when teachers and guidance counselors and they try to scare the bejesus out of you to not smoke, they always show you those extreme pictures of smokers lung and all that stuff. Don't get me wrong, I got nothing against people not smoking, but I do have something against scare tactics. But basically, what when they show you those black lungs, essentially, what that is they always call it tar again because they're trying to scare you. What they really should just say it is it's carbon. Okay, when you burn organic materials, carbon is going to be emitted, and you're breathing that in, and then that carbon is accumulating. And it takes years and years and years for your lungs to look like that, and it took a while for this person to get like that too. But it eventually got to the point to where this person was just could barely move and was smoking, so there wasn't a lot of forceful mechanical forces moving mucus out. Like I said, that's what made this person's mucus, like I said, literally just jet black. And this person eventually got started getting pneumonia. And because think about it, mucin, a protein plus water, you're breathing in all these pathogens, and they're just sitting there eating and growing and thriving. You're creating a great environment for them to thrive in. So then this person eventually got the picture and stopped smoking, and went from there. And I understood why the person did it, because in a situation like that, that was one of the few things the person really had left. In terms of a vice or just controlled in life, doesn't mean it was right, but I understood the reasoning behind it for that person. But obviously pneumonia was enough to make the person realize that patient realized that wasn't a good idea. So remember that the conducting airways are heavily lined with this with the ciliated epithelial tissue, with the exception of a couple areas that we'll cover more in depth in a bit. All right. Now, let's talk about the respiratory system and the two major divisions of the respiratory system. There's an upper respiratory tract and a lower respiratory tract. Now, obviously, there's some really important reasons why you need to know this, especially when it comes to classifying diseases. For example, you've probably heard or seen the expression URI, upper respiratory infection. You don't see URI that often, but it does exist because people are just more people just like pneumonia, for example. People just say pneumonia instead. But basically, URI, upper respiratory infection, that is an infection that is in your upper division. So that's an infection that's either going to be in your nose, your pharynx, or your larynx, or all the above. All right. Now, let's talk about this. So the anatomic structures in the upper division are going to be your nose, your pharynx, which is essentially just your throat, and your larynx. All right, your voice box. Excuse me. And then once we get below the larynx, then that's basically in the lower divisions. That consists of your trachea, your bronchial tree. That word. So basically your bronchi or your bronchial tree, because there's many parts to your bronchi aside from these, and then the lungs themselves, the alveolar air sacs within the lungs, and those are lower. That's your lower division. So typically, when people have upper respiratory infections, I mean, basically. We're going to have problems that are primarily associated with conduction, the movement and filtering of air that's coming in. So basically, like we've all had these before: sinus infections, allergies, head colds, as we like to call them, and they don't feel good because if you get an infection or you're breathing in a bunch of junk, you're going to increase the buildup of mucus to increase filtration, and then that's going to get you all plugged up, and it's not going to feel good. Or if you have strep throat, strep infection and again you get the picture. Whereas when you have lower respiratory infection, I put LRI. Sorry, I was wondering why I thought that looked weird. LRI. So whereas when we have lower respiratory infections, those are a lot more dangerous because remember, this is the lungs are the area where respiration occurs. All right, so basically now we're disrupting the actual process of gas exchange, and that's bad news because now we're disrupting our ability to bring in oxygen and get rid of CO2. Now the lungs themselves, or what was I going to say? Oh, probably the most common lower respiratory infection that you're going to find is pneumonia. And you especially are going to see that in younger people, in elderly patients, and patients that are immunocompromised, people that don't have very strong working, strong immune systems. All right, and then another very common lower respiratory infection that we're tested for all the time is tuberculosis. So like I said, those are infections that are confined, like I said, to the lower divisions, and then there are certain infections or problems that can happen with the upper divisions. All right. So remember these anatomic structures. So basically, what we have going on here with the upper division, this is where the bulk of the processing of air takes place. So because these, the spaces or areas in the upper division, especially the nose, we're talking about really close quarters here. Lots of mucus, lots of humidity. All right, so this is where we do the bulk of processing, especially in the nose. All right, we really don't do any processing of air, filtering, warming, humidifying in the pharynx, just because you're not gonna, with the exception of the nasopharynx, you're not gonna find that ciliated, mucous membrane. You're just gonna find stratified squamous epithelial tissue, kind of your typical mucosal lining. So that's kind of something to think about there. And then basically the lower respiratory division most of it is about dispersion, is basically about moving air into the lungs and dispersing it over a great surface area to where we're going to have gas exchange occur. Okay, so the upper division is your nose, your pharynx, and your larynx. The lower division would be your trachea, bronchi, and your lungs. Now, you'll notice that there is something that I didn't mention as a part of this, and that essentially is the mouth. Okay, the mouth, even though as humans we have the luxury of being able to breathe through our mouth, that's actually not part of the respiratory system. All right, now basically the pharynx, i.e. our throat, this is basically a connecting passageway. So we breathe air in through our nose primarily. We ingest food and liquid through our mouth, and they both, basically these passageways eventually meet up. All right, they join together. And then air, food, and water travel down towards the larynx and the esophagus. All right, and then we'll talk about how we separate the movement of air down the airways and food and water down the esophagus. But that's something to keep in mind, is that we just have the luxury of being able to do that, which is nice because I mean, that's certainly a biological advantage, because if we do have an infection, for example, if we have an upper respiratory infection, to where our nasal, we've all experienced this before, where our just nose gets so plugged up with mucus that we just can't breathe through it, or barely breathe through it, so we mouth breathe. And then how does that start to feel after a while, or even at the end of the day when I'm done lecturing, my voice is half gone, because I'm not talking through my nose. I mean, there's a lot of airflow in and out of my mouth. So that's something you have to keep in mind, that the mouth isn't lined with the same mucous membranes that you're going to find in the nose. That would be horribly disgusting. And so basically the mouth doesn't really filter air. The mouth isn't really good at warming or humidifying air either. So when we mouth breathe, we're bringing in not quite as clean and drier, cooler air. Now, let's picture how that's going to be a problem then, as that dry, cool, dirty air is passing by your mucous membranes. That's eventually going to start to kind of slightly dry out your mucous membranes, and that is just basically going to not feel good. You're going to get that really scratchy feeling in your throat, and that can make the infection even worse if you have a hard time filtering the air. That's why it's important that if you are real stuffy, that you do what you can to clear out your nose. Like what I always do is stick my head over a pot of boiling water. People like to use those Nebi pots, or there's that vapor rubs and whatnot. But it's really important that you keep your nose clear. All right. So that basically are the divisions of the respiratory system. Now let's talk a little bit about the nose. And so what we'll do is we'll talk about the upper divisions, and then we'll kind of call it quits, because this video is starting to get long. That's a pretty picture of a nose, isn't it? So basically, when we're looking at the nose, basically the nose is the beginning of the conducting airways, right? The nose is the beginning of the conducting airways. So as we breathe air in, it's first going to enter the nose through the nostril. All right, and the nostril is essentially what we refer to as air's coming in here. All right, this is essentially what we would refer to as the anterior nares. Okay, the anterior nares. And then, which you can't see here, which we'll take a look at in a sec, in the back of the nose, that essentially is where we're going to find the posterior nares. All right, or the back of the nose. Now, on the outer part of the nose, basically, about half to a third of the nose is bone. All right, so basically, the upper part of the nose is made of bone, i.e., the nasal bone. And then basically we've got the root of the nose, the bridge of the nose. And then basically we've got down here, we've got the tip of the nose. Now the lower portion of the nose, remember, it's soft cartilage. All right, this is basically this is cartilage down here, which is a much softer tissue than bone. Now that's important because remember, we've got the nasalis muscle in our nose here. So basically, when we need to increase airflow in, what we can do is we can essentially pull on this cartilage and increase the diameter of the nostrils, basically flare your nostrils. And basically that remember, if you create a larger diameter, you're going to have more of a substance flowing through that hollow area, right? So think about that. When would be a situation when you would want that to happen? Well, I mean, exercise, obviously. When you're physically exerting yourself and there's a greater demand for ventilation and respiration as well, you're gonna flare your nostrils a little bit, and basically you're gonna have more air coming in and more air going out. All right. Plus, you also see people flare their nostrils when they're mad, basically when they're stressed out and so on. But basically, that's kind of the pattern you see there. Whenever there's a need for an increased demand in airflow, we can pull on that soft tissue and increase the diameter of the nostril. All right, and then I'm sure we've probably all seen this before. If someone's ever broken their nose, if they've ever broken like the bridge of their nose, when they break their nose, they break the bony part of the nose. If the nose isn't set properly, or if it's broken so bad, sometimes you might see the nose heal improperly, and that could damage some of the olfactory nerves that are hanging in the olfactory mucosa, or that could obstruct airflow in and make it harder for a person to breathe through a nostril, and so on. All right. Well, let's talk about the design of the nose and essentially how it really carries out its job of processing air. Inside of the nose, we have these bones called conchae. concave, kind of like a conch shell. All right. Now, basically, what we've got here. So basically, this is a coronal section of the head here, and what we're looking at here, and oftentimes these are called turbinate bones. I'll explain why in a second. But basically, we've got an inferior, we've got a middle, and we've got a superior conchal bones, and the inferior are larger than the superior, essentially. Now, notice in between these conchal bones, there are these spaces that are called meatuses. Excuse me, meatuses. Okay, a meatus is kind of a space. All right. Now, like I said, when we first breathe air in, when we take that initial breath through our nose, all right, we have like I said, that's up to half a liter of air entering our conducting airways, right? So basically, that's a high volume of air coming in. And then what we essentially do is we squeeze that air tightly through these meatuses, through these spaces. All right, and then basically you have to remember that the tissue in between these spaces, in these meatuses, is lined with mucus. There's a mucous membrane in here. All right, so as we squeeze that air in through these tight spaces, that essentially maximizes our ability to filter air. Plus, these really tight spaces help us trap moisture that's in the air as well that we are breathing in. So basically, these spaces in between are really, really wet. All right, and let's take a look at more of a kind of a mid-sagittal view here. So basically, this is a picture of a model that we have that I took a picture of. So as we breathe air in, so remember, this right here is your anterior nares, and then back here, this would essentially, on the other side of these conchal bones, that would be your posterior nares. And then you've got a nasal septum that essentially separates both sides of the left and right side of the nose. And you're not going to really be able to feel that. If you try palpating that nasal septum, that's going to be some hardcore digging. I really wouldn't recommend trying that. I've seen people try it. I remember when I was in elementary school, a kid was picking his nose so hard, his knuckle was practically up there, and he caused a bad nosebleed in himself. I wouldn't recommend it. But basically what we have here, as you can see in this picture, we breathe a high volume of air in, and then that air it has to be squeezed through the smaller space. Now let's kind of remember when we were talking about the cardiovascular system, when we talked about laminar flow, layered flow. All right, that quiet flowing of blood. And remember what happens when you take a volume of blood and then you have to squeeze it through a narrow space, like you see when there's an obstruction, like like plaque in an artery, or when you're taking blood pressure and you compress an artery. What's going to happen is that same volume of blood is going to have to get squeezed through there, because there's the heart is generating pressure to drive flow, right? So that high volume of blood is going to get squeezed through that narrow space. However, as that blood is being forced through that narrow space, that's going to create what's called turbulent flow. And that basically makes blood kind of go ass over tea kettle, and kind of start to basically move in a more kind of circular, chaotic fashion. And those are actually what are called eddy currents that are created. Now let's picture that for a second. That's why this is essentially called why these are called turbinate bones, because they make air basically kind of spin through here with a whole lot of force. All right, kind of like a turbine. All right, so as that air is moving through here in a turbulent fashion, all right, is moving through these meatuses in a turbulent fashion, it's just sitting here banging up against the mucous membranes, and any particles that are in that air are just going to get trapped in that mucus, right? And then basically another thing too, as that air is moving through these meatuses and being squeezed through here with a lot of force, they're going to build up momentum or inertia, right? And then basically remember that kind of on the very end of the posterior nares, you've got the pharyngeal tonsil, often referred to as the adenoid. I'm just going to abbreviate that, pharyngeal tonsil. So now we're breathing air in. It's being squeezed through these tight spaces, and you know what's going to happen. The second it gets out of that tight space into a larger area, that air is just going to bolt out of there, and it's going to get slammed right up against that pharyngeal tonsil. And remember that the tonsils have very thin outer capsules, so if there's any, so which makes it easier for materials to diffuse or move through those capsules into the tonsil. And any pathogens that are in there will get picked up by the phagocytes and T and B cells that are located in there. Well, hopefully, anyways. So that's essentially how the nose filters air. It uses those conical bones to do so. Now, by the time air essentially goes from the anterior nares to the posterior nares and starts working its way down the nasal pharynx, it's almost 100% filtered. It's pretty much not all the way, but it's almost 100%, right? And which is a really neat feature because, like I said, we want that air to be really, really clean coming down. But like I said, because it's not completely filtered, that's why, going down the trachea and then the bronchi, there's more mucous membranes that are there to basically come in contact with that air and grab any particles out of there. All right. So that's essentially how the nose filters air, just by creating turbulent flow between the meatuses of the conical bones and building up inertia and blasting that air up against the nasal pharynx before it takes pretty much a 90-degree turn down towards the trachea. You ever stuck a flashlight up your nose or up somebody else's nose? While turned on, I should say. It doesn't really do you any good if it's not on. If you do that, I recommend doing it to somebody else instead of your own. Like, don't actually stick it up there, but shine the light up somebody, up a nose. If you're doing it to yourself, stand in front of a mirror and do that. If you shine a light up your nose is going to be bright red. All right, your nose is going to be bright red. And the reason for that is because underneath the mucosal lining of the nose, there's basically a dense network of capillaries in there. All right, so basically, as air is being slammed up against those mucous membranes, it's coming in fairly close contact with blood. Not close enough to where we can have diffusion and gas exchange because, we've got mucus, cilia, cells, a basement membrane, and in between the capillaries and that air, that's a lot of stuff in between. But however, it is coming close enough to collect heat. All right, to collect heat. And that essentially is how we warm air as we breathe it in. By squeezing it through these tight meatuses, these spaces between the conical bones, and getting it close to capillaries, that is essentially how we warm up air. And we warm up air to 98.6 degrees Fahrenheit, or 37 degrees Celsius, which you all know is body temperature. Okay? We warm it up to body temperature. And then how we humidify it, that's easy as well. Like I said, these tight spaces, these meatuses just trap moisture out of the air. Plus mucus is wet anyway, so as air is banging up against those mucous membranes, by the time it gets out of the nose, it's essentially going to be 100% humidified. All right, and that essentially is how we process air that we bring in through the nose. All right, and then basically what's going to happen then is air is going to turn down the pharynx and then head down towards the larynx. And I think this is where I'll stop because I think I've been talking for a while in this video now. So the next video, what we'll talk about, I'll talk about the rest of the upper division of the airways, and then I will talk about the lower divisions and the physiologic anatomy in another video. So this will probably be 3 separate videos.